morning, everybody. I'm Jon Pascarella, and I'm a dentist. I was born and raised in this beautiful little town, Red Bluff. Went to Red Bluff High, graduated in 2000, the first class of the new millennium. I remember that was important back then or something, or we thought it was cool at least. I tried out frosh football, realized I'm more of a tennis guy. My brother and I grew up riding our bikes through the slough, exploring, building forts with the neighborhood kids, things like that. We had a good childhood. I loved it. I went on to continue my education in Stockton at University of the Pacific. Jody was remembering that correctly, UOP. Great school, and continued on to UOP Dental School, which is in San Francisco. I had always dreamed about coming back to my hometown, and in 2008 I graduated, made that happen. So that was cool. I figured I would spend my time here answering the two most common questions I get, and giving my rebuttal to something that I hear almost daily that I don't like hearing. First question I get asked all the time is, why did I want to be a dentist? When I was a child, I didn't like my smile. I hated it. I had crooked teeth. It affected my self-confidence. I didn't like it. Dentistry changed that. In 7th grade, I was right over here at Vista, and I got braces. It changed me. I felt it changed me. My confidence started to grow. I became more outgoing. I liked the way that I looked. I wanted to be able to do that myself, give that to other people. In my senior year of high school, I started working in Dr. Moore's dental office. I was cleaning up rooms, sterilizing instruments, things like that. Started to expand to setting up rooms and even assisting the doctor. I got to see firsthand every day people's lives getting better through dentistry, and that was awesome to me. The second question I get a lot is, do I like being a dentist? I love being a dentist. My work-life balance is great. I get time at home with my wife and my beautiful little 15-month-old daughter. That's super important to me. I get to help people every day. People come with a problem, and I fix a little part of it. It's pretty cool. I also get to change lives by giving people that healthy, happy smile that we all deserve. On top of that, I actually enjoy the business side of dentistry as well. The business model that we have is 3 amazing dentists working together in 2 locations, one here in Red Bluff, one up in Redding. It allows us to serve a wider range of people and offer an expanded amount of services to our patients. On difficult or challenging cases, we work as a group practice. We put 3 heads together and offer the best dentistry that there is out there. So why do I hear it all the time? I hate the dentist. I hate the dentist. I don't like it, and I'm on a mission to end the hatred of dentistry. Some people have anxiety or fear of coming to the dentist. We offer a couple options of sedation dentistry to help with that. It makes the appointment go a lot easier, and many a times you're left with little or no memory of the appointment. So that helps a lot of people out. I know that cost is always an issue. The cost to take an unhealthy mouth up to healthy can be pretty high, but the value is so much higher. We work with a couple healthcare financing groups to help patients out, and we're super excited to now offer an in-office membership plan. It's a pretty cool model that is much cheaper than going out and getting dental benefits on your own. And on top of that, there's no yearly maximums for your coverage. A lot of good information on that flyer, and we can talk about that at the end if anybody has any questions. I also think that many times people hate the dentist because of prior bad experiences. A lot of those experiences happened in their childhood. The vast majority of those bad experiences do not need to happen. I think we can prevent them. I think with a little bit of education in our beautiful little town, educating people on maintaining a healthy, nutritious diet and practicing proper oral hygiene, we can do a lot of good for our town. I hope someday to be able to speak to large groups of the community and talk about those issues. So, I know I blew through that. This was my plan. So we got time for questions if anybody has questions. I brought Jody, my awesome office manager, along. She's been spearheading this membership program. This is something that we've been working on for probably 2-3 years now, trying to get it perfected and roll it out. So, questions?
Being that I'm a new mom,
Yeah.
I'm just curious, like, when do you start bringing a kid to the dentist?
That's an awesome question. So, the official party line is a child should establish a dental home by the age 1.
Wow.
A lot of people say, wow, that seems early. When I think of establishing a dental home, it's coming with you to the office. It's riding up and down in the chair, spraying air, spraying water, getting them familiar with the situation. By age 1, the only experience they have is going to the pediatrician, most of the time getting vaccines, shots, uncomfortable.
Yeah.
They associate a medical office with pain and hate. So if we can establish early those good appointments where they come, we got a little treasure chest. They go and get a sticker or a sticky hand. My favorite is the sticky hands. It does wonders for helping them enjoy coming to the office a lot. Question?
With
Anybody
this
else?
membership plan that
Yeah.
you're setting up here, is it something that is almost intended to replace insurance for some people? Because I know personally my dental insurance is comically lacking coverage
Yeah.
for what you pay for.
Right.
So, I mean, do you expect to see people kind of cut their existing dental insurance and just
Very good
work
question.
through the
So
membership?
where we are at right now, we are not offering an insurance program. It is a membership plan. It is only available for those that do not have coverage elsewhere, which is a little bit crippling. But like you said, it is a lot more effective than most of those dental benefit programs out there. We're able to offer it to somebody like you, a business owner who doesn't have the ability to get coverage elsewhere or their coverage is lacking. So I think it will open up a new market for us. Even the healthy adult who doesn't require more than their couple cleanings a year, a couple exams a year. That's really what it's designed for, is to help them out. When we do get a little behind in that and some other work is needed, there's benefits. You get a percentage off, which is actually much better than a lot of the insurances out there. Yes?
And for those who do have dental insurance, are you on most of the major networks?
So that is a loaded question.
Oh.
We are able to bill any insurance except for Medi-Cal or Denti-Cal.
Right.
The way they work is if you are contracted with an insurance, you're saying, as a provider, I will take whatever you pay. There's a lot of junky programs out there that pay 15 to 20 cents on the dollar.
Mm-hmm.
I wish my margins were able to work in that realm, but it's just not possible. So we do have a team of financial experts that can evaluate your plan and let you know, is this something even worth having?
Mm-hmm. But generally speaking, you will go ahead and bill the insurance.
Yeah,
And
as a
okay.
courtesy, we're able to bill the insurance, but you as a patient are responsible for the fee at that time, and whatever you get reimbursed from your insurance,
Sure.
you
Okay.
get. Any other questions? Awesome, thank you guys. Oh, go ahead.
More on the orthodontic side of things.
Yes.
So you offer the Invisalign
Absolutely.
traditional braces still?
Traditional braces, we do not do traditional braces in the office. We work with a lot of the orthodontists in the area. to do that team approach and provide that for patients. Yeah,
I have one more question.
lay it on me.
Okay, so you go to buy a toothbrush
Yep.
and you see soft,
Yep,
hard, and something in between.
yep.
And I know you can't give medical advice or whatever, but for the average person, if they go to buy a toothbrush, what do they want, the soft
I honestly have no clue why they sell anything other than the soft.
thing? Okay,
The
yeah.
softer, the better. It really is a technique thing. The proper way to do it right now is electric toothbrush.
Right.
It does the work for you. I have visions someday of maybe doing a YouTube video of showing the different techniques of brushing, because I know personally I was very involved in dentistry and I still didn't have the technique dialed in until years after I should. And I think that a lot of people would have an aha moment when they see the actual proper technique for brushing and flossing.
Yeah. That's a great idea. Yeah.
Anything else? Again, I brought my office manager, Jody, and so if we have any questions for her, we can ask those as well. So thank you guys for your time. I really have enjoyed this group as well. So thank you.
Okay, thank you, John.